Okay, now that you've delivered the baby, let's talk about how to take care of the neonate and how to do your assessment on a neonate and how to possibly resuscitate it if needed. So remember, a neonate, so an infant is 1 month to 1 year. A neonate is that first month of life. So that's what neonate means. So follow your standard precautions. Always put your gloves on before you handle a newborn. Fresh, new, clean gloves. The newborn should start breathing on their own within the first 30 seconds after birth. So when they're first born, you're going to dry them off really good and dry their back and wipe out their mouth with a gauze pad, and that should stimulate them to breathe in the first 30 seconds, 15 to 30 seconds. Their heart rate will be 120 beats per minute or higher, so they're going to have a really fast heart rate. Remember, an infant's heart rate is 100 to 160. So a neonate, we should see at least 120. If you don't see them breathing within that first 30 seconds, you can flick or tap the soles of their feet. The best thing you can do is just keep rubbing their back. Get a clean, dry towel that's warm, rub their back. If that towel gets wet from the vernix caseosa, throw it in the floor, grab another towel, keep rubbing their back nice and warm. A lot of newborns need some sort of stimulation to start breathing. So you may need to lay them supine and open their airway, but usually drying and warming them is going to be good. Suctioning, they're not really recommending anymore, but if you have to, you can suction the airway. I wouldn't do that in the first 30 seconds. Just keep rubbing them off, flick their foot, keep rubbing them, dry them off as best you can with a clean, warm towel. If they're not breathing, what's their temperature? Are they warm and dry? What's their airway? Is it positioned? Do they need suctioning? Can you wipe out their mouth with a gauze pad? Are they breathing? Can you stimulate them to cry? What's their circulation? What's their heart rate and skin color are going to be huge. If you have to do BLS interventions, dry and warm them first. Then, if you have to clear their airway, make sure you use a baby suction bulb so you're not giving too much suction to clean the airway. Stimulate them if they're unresponsive. Use an infant BVM to ventilate them if needed. You usually don't need to use a BVM. And then if they don't have a pulse or their heart rate is below 60 after 30 seconds of helping them breathe and their heart rate's not going up, you're going to start CPR. So to maximize the effects of this, position them on their back with their head down and their neck slightly extended. Suction, if you're going to suction them, suction the mouth first and then the nose. Babies are nose breathers. So if you suction their nose first, they're going to take a big breath and they're going to suck in all that stuff that's in their mouth. So clean the mouth out first. Then when you suction their nose, it'll stimulate them to breathe and everything will be clean. In addition to drying them off, you want to rub their back, flick or slap the soles of their feet. Remember, just keep saying dry them off. That's because that's the best way to stimulate them to breathe. Observe them for spontaneous respirations. Check their skin color. Are they moving their extremities? Evaluate their heart rate. The best way to check their pulse is you can use a stethoscope on their chest, or you can feel their pulse at the base of their umbilical cord. It's kind of hard to get a brachial pulse, and we never want to check a carotid pulse on a newborn. Remember, for up to 1 year, we could collapse their trachea. So you either want to go brachial, which can be kind of difficult, femoral in the crease of the leg, which can be kind of difficult. So with a newborn, to be sure, just use the stethoscope and listen to their chest or feel their umbilical cord right at the stump, right where it comes out of their abdomen. The heart rate is going to be the most important measure to determine whether they need further resuscitation. Remember, if they have a heart rate below 60, we're going to start CPR. So if chest compressions are, let me just recap for a second. So when they're first born, the first 30 seconds, you're just drying them off. If they haven't started breathing after 30 seconds, you're going to use a BVM and breathe for them for 30 seconds. At 1 minute, if they still don't have a pulse above 60, you're going to start CPR. So how do you do the CPR? You have to have two people. This is different from infant CPR. This is different from child or adult CPR. This is special to a newborn. You're going to do your BVM ventilations and your pulse and your compressions at 3 to 1. Okay. So 3 compressions, 1 breath. 3 compressions, 1 breath. It has to be extremely fast and coordinated. You're going to do the compressions. Another rescuer is going to do the breath. You have to have two of you. You can't stop doing compressions and do a breath after every 3. That takes too much time. So you're basically just boom, 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 breath, boom, 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 breath, boom, boom, boom. You're just pausing a little bit extra after that third compression to get a breath in. Any newborn that needs more than just a little bit of a couple minutes, a couple seconds of BVM, they need to go to a level 3 neonatal ICU. About 12 to 16% of deliveries are complicated by meconium. Remember, that's when the baby poops inside the uterus. If that meconium gets into the airway, it can cause them to have pneumonia or an infection in their lungs. So if they have meconium staining, use a gauze pad, wipe out their mouth, wipe out their nose really good. And if you have to use a BVM on them, suction their airway before you use the BVM so you don't force that stuff down into their lungs. Okay, the APGAR score we mentioned. So this is a standard scoring system to check the status of a newborn. You're going to check the APGAR score at 1 minute after birth and at 5 minutes after birth. APGAR stands for appearance, pulse, grimace, activity, and respirations. You don't really need to memorize every single one of these. If you have to use APGAR in the field, you're going to have a reference sheet on your quick reference book, in your OB kit. It's going to be in a lot of places where when you need it, it's going to be there. So a perfect score is 10. The worst score you can get is 0. It's between 0 and 10. So each of the 5 categories, you can get a 0, a 1, or a 2. Again, you're going to do this at 1 minute after birth and 5 minutes after birth. So let's look at what the 0, 1, and 2 are. Okay, so the best way to think about this is a 0 is nope, not at all. A 2 is yeah, they got it. And a 1 is well, kinda. So the first one is appearance. It's their skin color, right? If their entire newborn is pink, sweet, we're good to go. That's a 2. If the entire newborn is pale or blue, that's a 0. We don't have it. If their core is pink, but their hands and feet are blue, they kind of got it. That's a 1. Okay, go down to pulse. Remember, the normal pulse rate for an infant is 100 to 160. So if their pulse is at least 100, cool, they got it. If they have no pulse, that's a 0. They don't have anything. If they have a pulse, but it's below 100, they kind of got it. That's a 1. Grimace or irritability. Okay, if they cry when you try to move their feet, or you flick their foot and they cry, cool, that's a 2. If they don't cry or respond to stimulus, they get a 0. And if they give a weak cry, that's they get a 1. Activity or muscle tone. When babies are born, they want to curl up in a ball. They bring their knees up to their chest. If you try to straighten their legs and they're completely limp with no muscle tone, they don't have it. If they fight you and try to keep their knees up to their chest, cool, they get a 2. If they give a weak resistance to straightening their legs, they get a 1. They kind of got it. Respiration. If they're breathing nice and fast, cool, they got it. If they're not breathing, 0. If they're breathing slow, they kind of got it. They get a 1. So it's yes, no, kinda. Yes is 2, no is 0, kinda is 1. And then you just add them all up and it's a score out of 10. Okay, the APGAR score when assessing a newborn, again, you're going to get this at 1 minute and at 5 minutes. Once they're born, when you stimulate them, they should immediately start to breathe faster. If they're breathing well, go check the pulse. If they don't have a pulse, that's when you're going to start CPR. Check for central cyanosis. That means if their core, if their chest and their back is blue, that's a real problem. They're not doing well. They're not getting enough oxygen. Okay, again, you should always have a second unit on the way when you're delivering a baby, but especially if the newborn's in distress and needs resuscitation, you definitely need a second ambulance. If you have to assist ventilations, make sure you're using the correct size BVM, a newborn BVM. You should have one of these in your OB kit. And if the newborn doesn't start to breathe on their own or doesn't have a heart rate above 60, just do CPR and get them to the hospital as rapidly as you can where they can get the specialized care that they need.